Hey there, everyone. How's it going today? My name is Zach, and I am joined with Dr. Anish Shah. How you doing today, doctor?
I'm doing fine, Zach.
It's good to have you. Dr. Shah is joining us from Siyan Clinical in Santa Rosa, California. How's the weather out there? Pretty gorgeous, I imagine. You got some of that June gloom?
Yeah, it's beautiful outside today. It's lovely weather this week here in Santa Rosa.
That's awesome. Well, yeah, we're super happy to have you today. Get a little bit of your story, a little bit of your expertise. Wanted to just start with the basics. How long have you worked in mental health services?
Well, I've been working in mental health since 2000 when I started my residency in University of Illinois Chicago, UIC, and I have been practicing psychiatrist since 2004. Since 2012, I have been CEO of Siyan Clinical, one of the largest psychiatric practice in Northern California.
Nice. And what made you want to go into it in the first place? When you were a little boy, did you want to be a psychiatrist?
A good question, Zach. Um, Psychiatry is a field where a doctor gets to have twofold impact. One is to make difference in individuals' well-being, and second is to improve the life of a family. There's, it many social goals. But this is also very personal to me in terms of why I choose psychiatry. And tell you a little bit about that story. My own grandfather, before I was born, committed a suicide in early 1970s. I never saw him, but I was always intrigued by the story of his life, which I heard from my aunt, my uncles, and from my father. I heard a lot about after his death, how my grandmother handled the family. And even when he was alive, my grandfather struggled with his own psychiatric issues, and how my grandmother um had a pivotal role in the family, raising five children. So that always was an inspiring story that personally motivated me to learn about mental health issues. And my grandma's story was also amazing. Despite of depression all these years, she could raise the children and in those years and also do well for the family. So that was one inspiring factor for me. And that's how I made a decision after my medical school to go get into psychiatry. And these days, this has been my most enjoyable journey, helping people with depression and anxiety. And it's very satisfying and naturally calling for me.
That's so great. Yeah, that it can be satisfying again, that a little bit of your curiosity with even stemming from your grandfather's journey and all that, right? Clearly people are dealing with 2020, right?
Yeah.
All the events that have been brought on this year. What are some of the most common mental health issues that you're seeing right now?
Well, you said it so right, Zach. 2020. It's really a 2020 since so March this year. So in my practice and also among all the providers, what we have been seeing now is the stress and depression on rise through COVID-19 first. And more recently, we have been witnessing and we have been observing the George Floyd killing and the aftermath that has caused the turmoil in our community and also in our patients. Now, going back first to the COVID-19, that has really caused an enormous stress and anxiety among our patients, primarily because of the worry of economic impact, the burdens to the family. People have been more worried about their finances and also getting sick in general with COVID-19 or the family member getting sick. And lately people have experienced greater isolations than ever before, and that have made them vulnerable to succumbing to pre-existing depression, and depression has been in rise in following the COVID-19 issues. In last 2 to 3 weeks, I would say the George Floyd killing and the aftermath has caused a lot of fear, anxiety, and stress in many patients. I think, Zach, that people are very distressing to see such a high level of disparity and discrimination that still exists in our community. Um, and I think that is probably a primary reason for a lot of the hue and cry we have when the protest that we see in our people about finding the answer to the problems that we have not been able to solve all these years. And obviously that has, the protest is great, and that really is for the just reasons. Black Lives Matter. I do believe that. But this does have an inadvertent or sort of an uncalled for a consequence, with repeated media exposure, sometimes protests getting into a violent turn in certain communities. I think that is also causing a feeling of unsettling feeling, a vulnerable feeling, sort of a community as a whole experiencing some trauma, that we at this level. I'm also lately concerned about our children who are a little bit more traumatized with the repeated media exposure of what they've been witnessing. So those are the two things that I have been seeing more in last couple of months, and I'm sure the other mental health professionals are also witnessing the same.
Absolutely. Yeah. I've talked with so many psychiatrists, and we talk about, you limit your exposure to the news and things like that. There's so much that is out of our control that it is not super helpful to, just even the formula of media, right? When you're going for ratings, so often you're really hitting on those anger nerves and those fear nerves, so much out of our control. And then we talk about what we can control. So, maybe you could give us a little light on that, what we could do to keep a healthy mental state in all of this and getting through this year.
Right, right. A good question again, Zach, and I'm glad you brought this up. And I do have several pieces of advice that work for most people listening today. And some of this is probably not a surprise for most of them, but I would try to summarize though.
Okay.
First thing is exercise, eat well, and have a goal of at least 7 to 8 hours of sleep. Second thing is create healthy and positive social interactions, and develop some positive relationship and situation that you are really want to cultivate in place of those that aren't contributing any positive well-being. So cultivate positive relationship, interactions. Work to understand yourself and what motivates you in an uplifting way. Find out what's really giving you a joy. This is really a time to look at that more than ever before. Then avoid certain behaviors like you just mentioned, the media exposure. My suggestion is to limit 1 hour of day, no more than 1 hour a day. And because social media and also information overload can cause a lot of traumatic psychological issues such as anxiety, low mood, vulnerability. And one last thing along the media is limit yourself to information from reliable source. Look at the information where you can verify and you can be sure where it's coming from. So please don't view those WhatsApp pop-ups that comes every minute about COVID and George Floyd incidents. Just try to look at maybe some reliable sources through local government agencies and other ones.
Yeah, no, I think that's good to set a limit on that. I know I'm guilty of that. Some days, you're just in it and it's not real productive. I think that kind of brings us to the idea of like prioritizing our time. Now, coming out of, during the thick of COVID-19, right, when we were at, in our stay-at-home orders and things like that, you had talked about sleep, right? It's important to get 7-8 hours. So many people, if they didn't have a job to wake up for, if they didn't have school to wake up for, bedtime sort of went out the window, and again, more time on your phone and your media, things like that. So it was important, to really talk about prioritizing time. Now that we're coming out of it, I think that's probably still important. Would you say? I mean, we hear, over and over that that's a tenet of keeping a healthy mental state. Do you have anything to speak on as far as like your time management a little bit?
It does. It does have a pivotal role in prioritizing your time. But I would say it's not only prioritizing your time that I would emphasize. I would also emphasize knowing what is most important to all of us at this time. What will make the most positive difference? Obviously, there are daily tasks, there are daily routines that are high priority to all of us, and just because they need to be done. And I think we should prioritize and organize our time to get those things done, and that is very helpful. However, I would also say on beyond that is to put some energy into identifying what is most important to all of us, what is that is giving you the most joy, and then spend some time in doing things which are really giving us joy and fulfillment, and that would make a big difference into your mental health, I say, for sure.
I really, yeah, I can definitely appreciate that for sure. Well, let's bring it back to your clinic. You're up there in Santa Rosa. You guys have been offering treatments out there for years now. Let's talk about some of the modalities that you're using.
Here at Siyan Clinical, we are doing psychiatric evaluation, psychiatric treatment, psychotherapy. There's a primary thing that we do here at Siyan Clinical. We also do transcranial magnetic stimulation treatment, which is an FDA-approved, evidence-based treatment for clinical depression, which has no virtual side effects. So that is also we do here at Siyan Clinical. We also have a medication-assisted treatment MAT program for opiate dependence. We do some clinical trial. I also spend some time in doing fitness for duty evaluations and personal injury claims. So that is also part of my practice right now.
Very nice. Yeah, we chatted offline, and I think you said over the last almost 4 years, you've had about 130 people come through your TMS chair. Can you speak to that a little bit? That's quite a body of work, a lot of patients, and some of maybe the numbers that you've seen. People throw out words like remission from depression, and that really gets people's ears to prick. Is that real? Is that, what have you seen in those 4 years?
Well, thank you. We have started our TMS program in 2016. And since then, we have treated about 130 to 140 patients, somewhere around that range. And to tell you some of our success stories, 80% of our patients have had responded. Responded means that depression has gone by half, and about 35 to 40% of the cases have been in remission. Remission means the depression is non-existent. Like they are really, their self depression score on PHQ-9 or back depression inventory just points out that depression is almost non-existent. So that level of improvement that we have noticed in some patients, and about 40 or 50% of the cases have been able to maintain remission through at least 2 years. To tell you a little bit, out of 130 to 40 patients we have treated, we have repeated TMS treatment to about 20 patients or so forth. So there are also good success that we have in terms of patients remaining in remission after doing TMS treatment, full course of TMS treatment. And obviously TMS is not the only thing, then you also need to self-care and psychotherapy and all other things that you need to do to manage your depression. So I also attributed those successes that people have been able to undertake to manage the depression well. So that's how, that's our small story. We have 2 machines now in our practice, and we treat about 8 to 10 patients every day.
Wow, that's really great. Yeah, obviously, with this year and again, the pandemic and the George Floyd tragedy, everything that's going on, we've seen mental health searches really skyrocket, right? It seems that more and more, with a year like this, maybe the stigma is being lifted a little bit from, going out and getting help, getting professional help, right? There's, so, people are sometimes afraid of what people might think if they go and seek out a psychiatrist. When do you think that someone should seek professional psychiatric help, based on where they are?
And that's a good question, Zach. And I get asked all the time that when should I seek a professional help? Luckily for all of us, most of the emotional or psychological issues are mild, and I try to say everyone that preach the mindfulness and kindness and also the all other physiological measures that I just recommended in our conversation today, to do that first. However, when the issues are look to cross certain threshold, then I think one should look at mental health professional like a psychologist or a psychiatrist for a consultations. And some of the indicator when you should see is if the depression is pervasive, severe, where it lasts more than 2 to 3 weeks, anxiety and panic attacks that last more than 4 weeks. If you have a continuous sleep problem for more than 2 weeks, where you're not even sleeping 4 hours a day, extreme irritability or low threshold for dealing with any frustrations, family members are also observing that you are misunderstanding and misinterpreting the normal cues, suicidal thoughts, they're never normal. If you have suicidal thoughts, you should always seek out a professional help. And sometimes depression and anxiety is so pervasive that it causes cognitive problems, the problem with memory, concentration, procrastination. If that happens, one should seek help too. And then if you're looking yourself to be coping with your mental health issue with excessive alcohol or illicit substance use, for example, more than 2 drinks a day for men or more than 1 drink for a woman, and also using those substances to cope up with your depression and anxiety. And if you're doing that every day, then probably you should seek out a help, So these are some of the indicators I would say would be very helpful to keep in mind.
Yeah, I think that's so important. And I appreciate you kind of outlining and being like, hey, this is, there's people go through things that are normal, and then these are sort of abnormal behaviors that really spike. Right. This is an issue, and you need to talk to someone about it, and you've helped so many people over the years get these things under control with all kinds of different modalities. So we really appreciate that. I know you're a busy guy. We really appreciate your time today. I just want to give you, just the chance, if you have any extra advice for us or anything else you wanted to say about the clinic, go ahead.
I want to say 3 things at the end. And first of all, don't be afraid of getting help. Please ask for one. If your bone is broken, if you have a high blood pressure, diabetes, you will seek help. Likewise, if you have emotional problems, please seek help. Don't feel ashamed. And we still have a social stigma about seeking mental health or accepting that I have mental health. So I would say to all my listeners, they don't fear about seeking out for your help. And the help, the first would be to seek out help from the friends and family, and a lot of our patients don't seek out help because they have a fear of knowing what they don't know, or what would that look like if they know it, So the devil versus devil you don't know. So that's number 1. Second thing is, take your mental health seriously, like you would take your physical health. Brain is an organ. Just treat it with as much attention that you would give it to any other body part, like liver or heart and so forth. So seek out and treat it kindly. The last part is, in this testing time, like you said, Jack, 2020, that's where we are in. I tell all my listeners that these are a troubled time, and we'll get through this. We'll pass through this troubled time. And I would say, look at the good nutrition and exercise, and all. Look at your relationship, as I have mentioned before. Watch out for sleep, and more importantly, be kind to yourself and kind to others. Do something, even a little, for someone else. and what that would do to your emotional health is paramount. Living in the moment, living in the present, and also practicing mindfulness is also very, very useful during this testing time. So these are my advices to all listeners.
Well, I would say we got a lot of free advice today. So I really appreciate that, Dr. Shah. Thanks so much for telling us your story. Obviously, your passion for helping people is apparent, and we appreciate all the good work that you're doing. Best of luck to you. We got 6 more months. We can do it. We can get through 2020 together and beyond. Obviously, it's an exciting time for mental health and where we go from here. I think this is a great opportunity for you and what those next steps are. So yeah, we really appreciate it, and I'm sure we'll be chatting soon. Okay.
Thank you. Thank you.
Thank you, doctor. Take care.
Thanks.